Hi, I'm Dr. Kit Weathers, and it's time for the Root Tip of the Week. The other day we were playing a game of Yahtzee and rolled the dice, and I thought, wouldn't it be fun if I could take these 5 dice, roll them, and do a magic trick with the dice. Is just roll these dice inside the cup, shake them up really well, and then just use whatever numbers came up when I rolled the dice. And I'm going to really be careful to not look. I don't want to see what these dice are and what the numbers are. So we're going to stack them all up. And unfortunately, I have seen the top number, but that's okay. So what we're going to do now is make a prediction. And the prediction that I'm going to make is 34. I'm going to remove the cup and we'll add them up together. Now the one, we're going to throw that out because we're not going to use that number. So we have 6 and 6 is 12. And on the other side of this one that was hidden is another 1, so that's 13, 15, 16, 17, 18, and on the opposite sides, 22, 27, and 3 is 30, and then 4 is 34. Now what was my prediction? 34. So how do we do that? To learn the secret to this and other magic tricks in this series, go to EndoRootCamp.com. For this week's Root Tip of the Week, I'd like to spend a few minutes talking about a product that you may already be using, and that product is Septicaine. The generic name is Articaine hydrochloride. Now, because Articaine is a 4% solution, you only have to use half the volume that you would normally use with, say, lidocaine 2%. The other thing I want to remind you about, the Articaine has a half-life roughly 1/3 of lidocaine. Now the duration is going to be about the same, approximately 90 minutes. But because Septicaine has a half-life of about 22 to 29 minutes, that means if you had to go back and re-inject, say in an intraosseous situation, you could go back 3 times sooner. One of the things we just mentioned was the faster onset, but the same duration as lidocaine, which means it's a lot safer. You only need about a half, maybe 3/4 of a cartridge. With less volume, there is less epinephrine. Most of the time, Septicaine will diffuse to the palate and pre-numb the palatal tissue, which means you do not have to give a painful palatal injection in the vast majority of cases, and this is a big advantage. 80% of Articaine metabolizes in the plasma and only 20% in the liver. Now that makes it an excellent choice for anybody with a hepatic dysfunction and almost all elderly patients. Articaine also does a dramatically better job of diffusing through bone, and because it's very lipid soluble and it enters the bone much more efficiently, it's a great anesthetic for blocks. Now I know what you're thinking, what about paresthesia with Septicaine? Now we've been hearing about that for years, and I've actually done a little study on my own, and anytime I've done a root camp in the last 5-6 years, I've asked everyone in the audience, has anyone been using a 4% solution? A lot of hands go up. I tell the audience then, please leave your hand up if you've ever had permanent paresthesia as a result of a 4% solution. I've only had 2 people tell me that they had permanent paresthesia. A 21-year study was done and written up in the Journal of the Canadian Dental Association in the year 2000, and they studied literally millions of injections, and they found that the frequency of paresthesia with a 4% solution was 1 incident out of 785,000. CRA also did a study on 13,000 injections, and they found 1 paresthesia of the tongue and 1 paresthesia of the mandible, and neither one was related to the anesthetic. This was in June 2001. Now, this relatively low incidence of paresthesia that's being reported would probably lead most people to think, well, I don't think it's going to be a problem. It's almost negligible. In a study done by Stanley Malamed, 1,325 subjects experienced a rate of paresthesia that was 0.45% for lidocaine and 0.9% for Septicaine. All of the incidences resolved within 3 weeks, and Malamed concluded that neurotoxicity was not significant, just 1 out of 100. Now, 1 out of 100 might be a little higher than you want to risk, and that's going to be completely up to you. Personally, I think it's negligible, but whether or not you'll get into trouble, that's hard to say. I hope that at some point we will get rid of that stigma that the 4% solution is causing a much higher rate. However, if you look at the piece of paper that comes with Articaine and look at what the company actually says, Septicaine says that 1% of the cases experience paresthesia based on 882 patients in their FDA studies. Now, using the Canadian data, Dr. James Dower from the University of the Pacific calculated that paresthesia with Septicaine was 20 times higher than with lidocaine. The odds, however, turned out in his study to be 1 out of 37,500. To me, again, that's negligible. I'm not sure that that's going to be a big problem. However, make your own choices. Let's look at a couple more things. The bottom line, in my opinion, Septicaine has been used for millions of injections over the last 30 years, and the vast majority of clinicians have found it to be more profound and more effective than lidocaine. Okay, let's summarize. Septicaine gives us a deeper, more profound anesthetic, diffuses better through the bone. It has a faster onset and the same duration as lidocaine with only half the dosage. It's also great for upper infiltration because most of the time you will numb the palatal tissue. Reports of tissue sloughing and ulcerations, however, have occurred with periodontal ligament injections, so I'm going to suggest that you don't use periodontal ligament injections with Septicaine. In most cases, you will not need a block for anything on the lower from premolar to premolar. However, infiltration for lower molars is very unreliable, especially beyond the first molar. Some people are reporting good anesthetic with the first molar, and it depends on what you're doing. Now, I'm doing mostly root canals, and I need my teeth to be completely numb. So I'm not usually going to use Septicaine just in filtration. I'll use it intraosseously, and we've talked about that before. So the real bottom line is paresthesia with blocks is probably negligible. However, wouldn't it be better if we could just avoid paresthesia altogether? Let me give you a few tips now to help you not create the paresthesia. Here's a few suggestions to reduce any risk of getting paresthesia. 1, inject slowly, go slowly into the tissue, avoid hitting the bone heavily because you might bend the tip of the needle. And if you do feel like you might have hit the bone rather hard, take it out and check to be sure there's no barbs on the needle before you use it for a second injection. The way you do that is to just slide the needle over a gauze pad and see if it catches any of the fibers. If it does not, it's probably okay. If you do get a catch, obviously you should change needles at that point. Don't try to change the needle direction while you're in the tissue. A lot of people like to go in, try to get in, numb the lingual nerve, and then change angles and go in to get their block. If you do that, what's going to happen is you're going to wind up getting twice the amount of paresthesia that you would normally get using the same needle and the same injection technique. These tips will help you avoid paresthesia, but what if the patient does get some paresthesia? What do you do? Number 1, reassure the patient. Be sure and tell them that 80% of all paresthesia resolves within 2 weeks or less. And show compassion and concern. Don't underestimate the anxiety that paresthesia can cause. Patients don't like that numb feeling. Check the patient after 48 hours if they've experienced paresthesia, then at least once a week. If the paresthesia persists more than 2 to 4 weeks, definitely you should refer them to either to an oral surgeon or to a neurologist. Remember that surgical repairs will work best if you get them to a specialist within 3 to 6 months. Be sure and track the numb area. If the paresthesia persists, do a series of tests and find out just if it's spreading or if it's getting less. And finally, be sure and notify your malpractice carrier, and really most important of all, get good records. Make sure you write everything documented in the chart, because that's going to be your best defense if it ever came to a court case. Well, that's it for another Root Tip of the Week. I'm Dr. Kit Weathers, inviting you to join me at our very next Root Camp. So long for now.